Hi, Dr. Vu. How are you?
Hi, I'm doing well, Jennifer. Thank you for asking me to discuss COPD today.
Yeah, I'm so excited. You're my first physician interview for Breathe Easy with COPD, and the topic is really, really appropriate. It's how to manage COPD and live a normal life. But before we get started, I want to give you a few moments just to introduce yourself to everyone that will be watching this video.
Yeah, so my name is Steve Vu. I'm a pulmonologist here in Orlando. I work with Central Florida Pulmonary Group, and we do see quite a lot of COPD patients, and I've been in practice for 13 years. So definitely have seen quite a few people during that period of time. So.
Wow. So for a patient that's newly diagnosed with COPD, how would you describe the disease? What is COPD?
Well, to put it in simplest terms, or rather to define it, I mean, COPD stands for chronic obstructive pulmonary disease. Basically, it can be a debilitating lung condition where people have a lot of shortness of breath. And because of the shortness of breath, it really affects their day to day life. Um, Most people who have COPD is because of many years of smoking or some type of exposure to chronic air pollution. So, but yeah, so it can be a debilitating disease, but people can, with the right treatment, the right mindset, people can live a productive life. So,
Very good, very good. So how can a COPD patient manage their disease and live that normal life? What are your recommendations when you have a new diagnosed patient?
well, really the cornerstone is if they are still smoking to work on the smoking cessation part. And I know that's difficult for a lot of people, but there are good treatments out there to help reduce and cut down and eventually to stop tobacco smoking. The second important aspect is having a diagnosis and um, knowing how to manage your diagnosis. So, taking medications designed for COPD, staying up to date with vaccinations if you're in that age group, and then just engaging in some form of daily exercise is important. So.
You mentioned medications. So can you go into just briefly, just to explain to patients what is a COPD maintenance medication? Like, what is the purpose versus a rescue inhaler? And why should they take their maintenance every day?
Yeah, so rescue inhalers are typically um, medications like albuterol or ipratropium. They're designed to work quickly, but they don't last long, perhaps 2 to 3 hours, and then the individual would have a recurrence of their symptoms. So, maintenance inhaler, on the other hand, is a medication that's designed to stabilize the person's lung function and also their symptoms. So those medications last longer. At most you would take them twice a day. Some of them are once a day. So yeah, there's the difficult thing is that there's at least 30 different medications on the market.
Yeah.
So, and I think sometimes patients have a hard time navigating, um, which of the maintenance inhalers could be best for them. So,
Now, you said you've been practicing for 13 years. When you have a patient with COPD and they genuinely listen and follow your instruction, they're compliant, they stop smoking, they take their maintenance medication and all their prescriptions as prescribed, and, they try to exercise and eat healthy. What have you seen with patients that are compliant as far as like their lives, like the impact of COPD on their life?
so for the people that are pretty active, or I should say proactive, in accepting their diagnosis and quitting smoking and being compliant with their medications, I do see that a lot of them have improvement in their symptoms. They're able to do a lot more than they had previously. And also, they have less risk of having what we call exacerbations, because every time you have an exacerbation, you do lose a lot of lung capacity and you might not get that back.
Now, when you say exacerbations, maybe a patient doesn't know, that's when they're short of breath and they're having a hard time breathing, right?
Right. So the main symptoms of an exacerbation are shortness of breath, lots of coughing. They could have a lot of sputum production, but basically, it's a worsening of their symptoms compared to their baseline.
But that's good to hear that if patients are compliant and they take all their medicine, that their symptoms, they can manage their COPD and live a normal life.
Oh yes, I mean I've had people who, you know, they almost do like a 180. So they're going outside the house, they're doing activities that they normally had to give up. Um, so, and I think that when a person loses the ability to engage in their normal active daily life, there's a strong association with depression. So, so I do see a lot of people suffer from depression because of their chronic lung disease. So, so definitely important to get that under control.
Very good. Well, you have given so much insight and so much knowledge today, and I just genuinely want to thank you for your time and for just your day off and volunteering this information to help more patients be educated and be empowered so that they can manage their COPD.
Well, thank you very much. Thank you.
Thank you.